Hi, I'm Dr. Stephen Stokes, and I'm going to do a brief video about the PEMF Pulse XL Pro therapy device. PEMF is getting a lot of attention, and it's changing the way we practice medicine. In my office, I see results with pulse electromagnetic field therapy that I can't even explain. People coming in with problems like back pain, and after doing 10, 20 hours of this therapy, they're telling me, oh, by the way, I'm not getting prostate symptoms anymore, and I had an enlarged prostate. Or they're telling me that their anxiety is gone, and they were suffering from clinical anxiety for years. All sorts of miraculous things are happening with PEMF therapy. The problem is that I also get about 2 emails a day from doctors all over the United States who find out that I have an XL Pro, and they're asking me, what do you do? What are your protocols? Everybody's so hot on these protocols, like there's some magic ingredient that they're not getting. So I think there's a lot of confusion about how you use these devices, and I just want to explain to everybody out there how we use them and how we set up the room. I want to give a Pulse XL Pro hack video, if you will. And this is just my opinion, so you may speak to you differently. This is just what we do. So the first and foremost thing is that with the XL Pro, you can control 3 different variables: time, pulses per second, and field strength. And the most important one to think about is the pulses per second, the frequency. And there's all sorts of information out there about how different organs like different frequencies, and all of this, in my opinion, madness. None of that speaks to me. None of that is my experience. My experience is very simple. When I use a low frequency, so between, say, 2, 3 pulses per second, all of that energy that I'm generating seems to get caught up in the muscle system. And I'm getting a lot of contraction of those muscles. And that may be good for some problems if it's muscular. So if I have a patient that has, a lot of soreness in their trapezius muscle, or they've gone for a run and their quadricep is really bugging them, then you can use those low pulses per second and drain that area quite effectively. And so there's value to that. Also, I notice that when I turn that up from 2 or 3 pulses per second, when I get up to the range of 7, 8, 9 pulses per second, I'm not getting as much of that rapid forceful contraction in the muscles. And it is my understanding and my belief that the energy is therefore not getting caught up in the muscle system, but it's passing deeper into the cells, into the mitochondria, which is what we're really after. We want to charge up those cellular batteries. So I find that higher pulses per second produces a greater effect on the healing of the system. Lower pulses per second may seem more dynamic to the patient, but I think that in the big picture, it is not what we're striving for. So I treat patients for 15 to 20 minutes in a session. That's all. We use as high pulses per second as the patient can tolerate, with the goal of trying to be up around the 7, 8, 9 range. In an area that's very sensitive, like the brain or the head, those higher pulse ranges are well tolerated, versus the low pulse ranges in those sensitive areas can really irritate and aggravate the patient. So the goal is as high pulses per second as the patient can tolerate for 15 to 20 minutes. Then, when I'm done with that initial 15, and by the way, we're treating full body. We're not using paddles or rings on specific areas. We're going after a 15 to 20 minute session of whole body. So we'll get into the accessories in a minute. We're using the bed or we're using the chair to get the whole body, to get the maximum saturation of that magnetic field into the entire person. After that 15-20 minute treatment of high frequency, then I will usually do a 5 to 10 minute cool down period where I will go and lower the magnetic field and lower the pulses per second. I'll bring it down to 2 to 3, and I'll do 5 or 10 minutes of that to activate the muscles and just to flush that area. And it's a nice cool down, and the patient ends up with getting less adverse side effects after the treatment if they do that. It just seems to work well. So that's my real approach, right? It's a 15 to 20 minute session of full body PEMF, followed by a 5 to 10 minute cool down period, where I'm using lower pulses per second in the cool down period and as high as possible in the actual treatment period. So the patient gets the PEMF in my office for about up to a maximum of 30 minutes. And that's it. So there are paddles and there are other accessories which I'll show you, and there are rare occasions where I will target an area like that if I need to. But in general, I find that the best long-term results come from full body treatments. So let's have a look at how the room is set up. We'll go from that next. So first things first is that I do have the accessories. I have the paddles and the rings. And there are occasions when if I just want to do a quick 10 to 12 minute treatment on a knee or something and I don't have time for the full body treatment, I will use these rings. Or if I'm doing something like a soft tissue, like an organ where I just want to go to a gallbladder or I want to use the brain, I'll use these paddles to focus all the energy into those areas. But this is not mainstream for me. What you need to do is go to Home Depot or Lowe's and buy this Rubbermaid setup. There it is right there. And this is awesome. So this setup you put on your wall, you can hang those, they look good, it's streamlined, and it isn't junky. If we look at how the rest of the room is laid out, I have chair and I have the footstool. I have also the full bed. I'm using the pad underneath the legs on the bed, as you can see. That's extremely important. I'm also using a half moon pad behind the shoulder area so that when the patient lays down on this, their body is making full contact with the coils, and that's really important. They have to have full contact. If they're sitting in the chair and they have forward head posture and they're off the chair by 3 or 4 inches, you're going to lose efficiency on that treatment. So you want to make sure that you have it arranged so that when they sit or lay down on the coils, their body is making as direct contact as possible. In my office, I also like to use enhanced air. So we have 2 even flow oxygen concentrators here, 5 liters each. We hook those both together through one long cannula so that the patient can get between 8 to 10 liters of oxygen per minute while they're getting their PEMF therapy. The second thing to do with this oxygen therapy, just as a side note, is that I'm not using double humidifiers. So I'm only using 1 humidifier because if I use 2 humidifiers, I'm going to cut the amount of O2. And I don't want to do that. So I'm just using 1 humidifier. That seems to be enough to make it pleasant for them to breathe that in. Next thing is that I have a nice medical grade cabinet that I purchased right here that you can put your computer on, you can do your notes. It looks good in the office. We can display some brochures on it. We have the white container where the patient takes everything out of their pockets before they get the treatment. And I have a flat screen TV on the wall. And patients will sit or lay down for treatment. They'll watch HBO or Netflix, and it really makes the whole experience, just high-level experience, pleasant for the patient. You need to buy this poster from Pulse Centers, and you need to get it framed. Don't just stick it on the wall. Spend some money. The equipment you're purchasing is costing you between $30,000 and $40,000. You can afford a $20 frame to put your poster in, and it looks so much better. So I have this poster here, and the other poster that I really like is this one. And I'll see if I can get close to it. And this is a poster that shows the grapes and the raisins. And what it does is it explains the idea of PEMF therapy and the cells of your body as a way to improve nutrition flow and restore the cell's natural repair cycle. And this is exactly what we're after. So patients can relate to this picture. The idea of their cells are like raisins and the PEMF will make them like grapes. That just sticks in their mind, and it's a great tool to have. I also have a ADC electrical blood pressure device here. We take blood pressure on every patient, every visit. It's a great way, and we also do perfusion. So it's just a great way that the patient can see how this affects them. And they see their blood pressure and their oxygen perfusion change. Usually blood pressure will go down dramatically after 20-30 minutes of this therapy, and they'll see that. And perfusion index, amount of oxygen in their blood with the pulse ox, that will go up dramatically, and they'll see that. So that's really a great way to justify in the patient's mind that they're getting a full experience with the PEMF in my office. So I hope this was helpful. Just one way to make it easier for the practitioner. I know there's a lot of doctors out there that say they get great results with 60-minute treatments 3 times a week. It's not what we do. We see the patient for up to 30 minutes, and we see them every day, Monday to Friday, for 4 weeks. So my standard protocol would be 4 weeks of treatment, Monday to Friday, for 30 minutes per procedure, and that's going to give the patient a total of 10 hours. And for me, 10 hours is the magic number. 10 hours of therapy is the minimum amount of PEMF therapy that I see any long-term change with. And I have patients in here that are doing 30, 40 hours of therapy. I do it every week. and the results just continue. You know, they just get, just like exercising. The more you exercise, you get stronger and more healthy. The same with PEMF. There's no real limit to this, but you definitely want to get the patient, encourage the patient to at least, at least endure 10 hours of therapy. If they're going to do less than 10 hours, they're not going to be happy because they're not going to get that long-term benefit. So the minimal package would be 10 hours, and then we sell 20, 30-hour packages as well. But I always demand that the patient try to come every day for the first month. It's that important. And if they come every day, a 30-minute treatment will work out fine. Hope it was helpful. If you have any comments, go ahead and email me. Thanks.